Hello, health heads. Welcome and thank you for checking into this dose of the Healthcare Uprising. I'm your producer in the back, Jeremy Carr, here with your host in the front row, Heather Pierce. So, what's on our agenda for today, Heather?
Today, we are covering more women's health. Surprise, surprise. We are meeting with Pachet Bryant, who is the CEO and founder of MINE Maternity. That's MINE, like mine.
Like mine.
Yeah. MINE Maternity. MINE Maternity is essentially addressing the maternal health crisis here in the United States of America. And we do have a crisis.
We have a lot of them these days.
Crises here.
Yeah.
Maternal health being one of them, for being a, first world country and developed nation. We got a lot of problems. So she is helping to address one aspect, helping to connect pregnant mothers and post-pregnant mothers, so pre-postnatal, with financial resources to help them through their pregnancies and afterward, so that it doesn't feel like as much of a burden. But that's 8 years in the making. She's been developing this lovely organization, and honestly, she's one of those people that saw a problem and decided to solve it through seeing some of her own challenges and some of the previous roles that she had. So
yeah. Basically seeing moms through the entire pregnancy, birthing, new mom process.
Yep.
From the financial side.
The care coordination, financial, some other things, cover doulas again. So, yeah. So
right on. Sounds like it's going to be fun. Let's get into it. Without further ado, here's our conversation with Pachet Bryant from MINE Maternity.
Hi, and welcome to the Healthcare Uprising podcast. We have Pachet Bryant, CEO and founder of MINE Maternity, with us today. Welcome to the show, Pachet.
Thank you. I'm excited to be here.
Great. Well, let's jump right in. So MINE Maternity, not a brand new venture for you, but you've had some big changes in the last few years, or maybe even just in the last year. You've gone through some transitions. Can you talk about, like, right out the gate, the journey, where you started, where you went, where you're going, where you're today, and really just what you're trying to achieve?
Definitely. So we've been in the space for a while, since 2017. I started out as a nursing and maternity bra company, believe it or not. And from there, that just led to me going heavily into maternal research. So I ended up going the maternal research route, and then the advocacy route. And I really found out that resources are more importantly needed, and services. And so we changed from a product-based company to a service-based company. And from there, we've been supporting in the care coordination aspect. And just this year, as of 2025, there's been a huge need and emphasis on benefit navigation, especially with just the changes that naturally come and go, as well as any political changes that happen. And so benefit navigation is now the key portion and key service that we provide in addition to care coordination.
Yeah, benefits are always complicated. Like,
yes.
I've worked at multiple companies. I've had private insurance. I've had 2 children, one in private, before ACA, and even after. And I can tell you, and I've worked in this industry forever, and I can still tell you, you're just like, what? What's available to me? How do I get that? I have no idea. It's just like, everything's so siloed and just kind of, you don't have a single source.
It really is. And that's why when I talk to people and I work with other, doulas or other businesses that provide maternity care, I always like to let them know that it's not your fault that you don't understand it. It's because it is complicated, and it's meant to be complicated and very fine print based. And that's where having somebody who can, who's familiar with the space and can help you understand where your insurance and what your benefits are, even outside of insurance, includes. So you can really get the care that you deserve, because it's available. You just need to know how to access it.
Yeah. And having a baby is a huge thing, right?
Oh yeah. And speaking to someone who's within the 1 year space.
Oh, I just sent my 16-year-old off to his junior year of high school today, and my 11-year-old to 6th grade, first year of middle school. So the baby years are a little behind me, but I my sweet little nephew just moved in down the street, so I'm elevating my auntie status right now and getting better at the baby stuff.
That's how I remember how long I've known you is how old your kids are. I've known you a long time.
See that? Yeah, Jeremy and I go way back. Um, so really, MINE Maternity today exists to support women who are pregnant, going through pregnancy, post maternity, postnatal. Am I
Yep.
saying that right?
Yep. Absolutely.
Okay.
Postnatal,
I'm like, I should know
postpartum.
this.
You know it. You know it. You got it. Yep. Postnatal, postpartum, both are the same.
But and more kind of, as you said, really focused on benefits navigation, financial resources. So can you expand on that a little bit? Like, why would somebody need MINE Maternity? Like, what is the complexity and the confusion with financial resources? Like benefit navigation, I'm sure too, like if you have an employer, like they all have different types of kind of supplemental benefits. So I could see that being one thing, or understanding what's covered, right? Like through your insurance premiums. So is it kind of the is it also like the additional financial resources for somebody who may need it for, I don't know, all the different things that could happen?
Absolutely. That I love that question because so our slogan is unlocking the financial resources. And so what that encompasses is, we take a look at the main three. Those include insurance, FSA, HSA, and then employee assistant programs. So that's if you hear about things like Maven and Carrot and Modern Health, that's part of your employee assistant programs, also known as EAPs. In case I ever, throw in an acronym, that's the EAP I'm mentioning. We also make sure to take a look at if those three don't cover it, then what do your government programs include? And government, as far as local, so that's county based, that's also looking at state and federal because they all service maternal health and provide maternal health resources, but it looks differently from each component to what scale and maybe what demographic that they're servicing. And then outside of that, if those four aren't working for you, then what not amazing nonprofits exist that specialize in maternal health care. So, are they, focusing on providing lactation services and consultations for free? Are they having community prenatal visits? We're seeing a huge shift in community resources and community visits with healthcare professionals. And is it focusing on mental health? So, really, between those five, we're going to get you the care that you're looking for, no matter which avenue that financial avenue that you need to start with.
What do you mean by community visits? Is that like a group session, as it were, kind of thing?
Yeah, it is. So, and I'm really excited about it just because, especially with the shift that we're seeing in just the medical industry in general, but we're seeing a shift towards community-based care. And so that is having a community group visit that's focused on your prenatal care or mental health care, but it's a group visit. And then, you may, go off on for a one-on-one within that period of time to work with the specialist individually. But it's a group dynamic in its sense.
Hmm, that's really interesting.
Yeah.
How is that often literally the first thing that popped into my head, and I want to talk a little bit about how kind of MINE Maternity can show up for people. I thought of immediately federally qualified health centers that often already do a lot of community focused health events, either for immunizations for kids or wellness checks, right? Like annuals. Is it similar? Is that like a partner, or could those be partners, or are you seeing that happen?
So, in this circumstance that I'm talking about, they're actually independent agencies or independent clinics that are providing this care. So, they're outside of the federal funding realm.
Oh,
And there are benefits to that because that means that they can practice the way that they want to practice, whether that's, as a doula, as a midwife, as a, sleep consultant or a chiropractor. They're able to practice how they want to practice because the funding is coming from their own internal sources or donations, or maybe the visit itself is being split between the people who are attending. And so instead of having to pay maybe the $100 out of pocket yourself, you're paying maybe $20, or you may be paying, $10. And this is really important if that care that you're seeking isn't covered by your insurance. So it's a copay amount for a full service visit.
wow. Okay, I have not heard of this.
Yeah.
That's pretty brilliant,
Yeah.
I love
especially, you know, there's plenty of people without insurance at all in this country.
Mm,
So if the more of that that's going around, the better for
yeah.
all them. So
Well, and just the lack of PCPs, the lack of specialists in, but particularly in rural areas, this comes up all the time. Um, you know, I just heard about another PCP office shutting their doors in Upper Michigan because honestly, because of the complexity that the insurance companies create.
Yes.
wow,
And I'm
So
unfortunately hearing a lot
that
about.
is not an uncommon story these days. Or they get, absorbed from like a larger health system, or you get real innovative, right? And you start doing these community events, which I think is brilliant, as Jeremy said.
brilliant. Yeah.
I concur.
I
I
love
mean,
it,
it
especially.
obviously wouldn't work with everything, but with certain
Yeah,
things, there's no reason why a doctor can't see 10 people at a time.
I
When they're all like it's a bunch of pregnant women, like, okay, how was this? And they can all just answer the questions all at one time. It saves so much time. Why
and then
not?
just have that one-on-one within maybe that specific area of time, but for the general basis, yeah, a lot of it is something that not only people can share about and feel comfortable sharing about, especially for just routine prenatal visits or postpartum visits, but it gives also a sense of community within that cohort. So within that
Mm.
group,
Yeah,
now you immediately are connected with other moms within your trimester, within your
Oh, that's so
birth,
smart.
yeah, birth range. So it builds community. Like I said, I'm a huge fan of it,
Mm.
especially with people wanting that type of service and care.
sure.
So, okay, so with MINE Maternity, so we talked about benefit navigation, um, unlocking that financial access. Is that the right word? Or
Yes, unlocking the financial resources,
financial
insurance
resources.
support, yeah, things of that nature. Mhm.
So, can you give some examples, like specific things that you would like a person comes to you, right? And you get connected with them to provide this support. Um, how do you like what happens? What does that feel like? How do you know what they need? How do you know where to look? Do you have all these partnerships in place? I just kind of expand on that a little bit.
I'm happy to. So, as far as what the experience, as I like to say, the client experience, but as what the experience look like is, I always have a client intake form that I want people to fill out. Gives me a sense of what they're looking for as far as, the service that they want. So, is it, at home midwifery care? Is it doula care, which is our number one that people are searching for? As far as does my insurance cover this? Or is it chiropractic care, mental health? If we have a large length of services that we can look for, and then you can always put your own as far as other. But we have a form that we want you to complete. And then personally, I'm a people person naturally, but it also is nice to have a 15-minute consultation with the families that I'm supporting or the individual that I'm supporting, so I can kind of learn a little bit more about your specific needs beyond the form. Like the form will get me enough to where I can technically look through your insurance and actually pinpoint it to the services that you seek. Because when you look at your own insurance, unless you know where to look for it, it actually doesn't lay it out, even in your summary of benefits. So, for instance, lactation services is not quote unquote lactation services when you look in your insurance. If you're looking for doula care, it's not doula care, or even pelvic floor therapy. It's not pelvic floor therapy. You have to kind of know where the subgroups and where they would go in to know how much it's covered. And if you see in network or out in network, what does that look like? And so that's why I provide an insurance check report that takes all that jargon away, takes all that language away, and puts it in plain language. Hey, if you want to see a lactation network, to see somebody in-house because of ACA, it's 100% covered. If you want to go out of network, then just be sure to, you expect a $40 copay. And the last insurance check that I saw, it was really exciting because that individual had in-home care, like specifically specified, so they could see somebody within their office. Like if they wanted to see a lactation consultant, they can go to their office or clinic, but they also had coverage for the person to come to them.
Oh,
Um,
wow.
that is so nice at the copay rate. And just so we make sure we're all on the same page, copay is that amount that you pay, even despite kind of all of the other like deductibles and all that other fancy language you see. It's the amount that you can walk away with. So $35, that's what you walk away for the visit.
Nice.
That's crazy that the language part of it that you were just describing. I mean, and I think you said it earlier in our conversation here that um, healthcare is almost intentionally designed to be difficult to navigate.
Yeah.
And it's that language, the way that things are kind of buried in the policies. How do you find,
And every company does it different too. They don't have
Yeah.
any industry standards. It all depends on who you're dealing with as to what paperwork you got to fill out and what the
Mhm.
language is going to be in the paperwork. And it's crazy, man.
Even the coding, can you provide a super bill? And if you ever hear the word super bill, it just means, a bill that says, hey, we provided doula services or we provided lactation services for this state. So it's a very, high level bill versus some companies want an itemized bill. And when they ask for itemized, then somebody needs to know, coding. Like, how do I pinpoint this service to this coding? And that's one of the services that MINE Maternity provides businesses as far as billing support. But it really did, like you said, it depends on your insurance company. Like some super bills, good enough. And then for others, we need to see it itemized. And that can be complicated for not only the person seeking the services, but then the business who's trying to offer them. And sometimes what I'm seeing is businesses like doulas and lactation consultants and other maternal out of network, practices. They're saying, sorry, we can't take you because we don't know how to navigate that.
Mm.
And the best we can do is this. And if that's not good enough, then I'm sorry, we don't know how to help. Thankfully, MINE Maternity is bridging that gap. So then businesses are empowered to say, actually, we do have someone we can consult in-house and, provide whatever you need. And then if your client is looking for exact understanding of their benefits before they opt in, they also have that option.
Hmm.
I know.
It's
I was like, that's a lot said.
but it's just mind-boggling to me that I don't know how many
That those
times.
that those hoops exist
Yeah,
to jump through.
it,
Yeah.
I feel like a broken record, Jeremy, that we say this a lot on the show, and that then companies like yours show up to solve those problems, which is amazing. Um, and and I do want to ask too, because mine maternity is in terms of delivering services, although that's relatively new. When did you start changing that business model, and how do you get in front of people? Are you individuals can call you? Do you come through health plans? Do you come through employers?
Yeah, I love that question. So through the website, individuals can always reach out to us as well as businesses. We have a multitude of ways that you can contact us. So happy to support individuals specifically. The best way though is especially within the space of maternal health, we're finding that it requires a lot of trust. And so, because of that, we have a provider village that we're a part of, and we're partnering with a multitude of already established you know um, entities that have relationships with the patients or clients, however they address them. So for instance, we work with midwives across the nation, we work with doulas across the nation, we work with the providers, and then the providers connect us as they see fit to their clientele who's seeking this service. And so it adds a boost to their business, but it also opens up to the client saying, okay, my provider who I chose, who I trust, is referring me over to MINE Maternity. And so that has been a huge shift because when we started, just like any business, we were going directly to consumers and saying, hey,
Mm-hmm.
love to help you with your maternity journey. And I was having my business cards and, going to parks and things. Well, I mean, I was naturally there with my baby, but, just introducing myself. And even if they said, oh my gosh, I need this, this is great, I can afford it, I still never got the call. And so I realized it's that trust factor. And so that's why we shifted over to working with the providers directly and
Mm-hmm.
moving there.
Yeah, that makes sense. And I'm remembering a part of our conversation with Seth from Wellbe Health, Jeremy.
I
A
was
couple,
thinking of him earlier
we're,
in this
yeah, a
conversation.
couple of episodes ago because I remember him making a statement about people, they leave jobs, they change insurance carriers. They're not loyal to the carrier. They're not loyal to the insurance payer, whatever term you want to describe them, the health plan. They're loyal to their doctor, right? Like that's the relationship that people look for to have for a long time, right? Like we're not we're not doctor hopping for the most part,
Yes.
particularly with women's health, right? Like when you find one, or you like your girlfriends and your family and every other female that you know is saying that's a great clinic or that's a great provider or what have you, like that word of mouth is so powerful, and then you're with that provider, so it makes sense for you to come in through the provider, then which then enhances what the provider can do for their patients, which then in turn makes them look good
Yes. Yeah.
and helps the patient, right?
And it
Ultimately,
helps.
that's what we
Yes,
want.
that's the ultimate goal.
Yeah.
But like you said, it's that trust in the provider that's been established because they chose to stick with that provider even if their insurance changed, and we see that all the time.
Yeah.
And it's a better way to get it direct to the people that need it, because the pregnant women are going to the pregnancy doctors who are going to be signing up with you. You know what I mean? And instead of having to go to each patient individually, you can get, one doctor brings all those patients into the fold. So
Yeah.
it makes more sense that way. But people can individually still approach you though, like through the website and stuff.
Absolutely.
Yeah.
Yes.
So there you go.
Website. Yeah. Reach out. All that you want.
So you work with a lot of different people, right? So you've got varying needs. And even when I went to your website, I read some of the testimonials, and there was one from somebody who has PCOS, which we've covered on the show. There was one that there's so many connection points. This is like the women's health stuff is kind of like all over our kind of DNA here at the uprising.
Please.
By
Continue.
design, it might just because be passionate about women's health. um, but you deal with patients with PCOS. Maybe you're dealing with I don't know, maybe somebody's in a like low income, right? Like needs like a lot of financial resources. Maybe you get somebody that doesn't really need like your local community support, but just needs help navigating. So you're seeing a lot of different scenarios.
Oh, yes.
Is there anything that stands out to you as being like the most common issue or like or need that folks come to you for, or they end up with you and they didn't know they needed it until they needed it?
Okay, I have two answers for the first part, and then I have one answer for the first part, and the
Yeah,
second.
sorry for my long-winded question that just like took a
I
couple of turns there.
I love it. So as far as this, what I find that's, most relevant as far as what people are in seek of, would be doula coverage. So that is for those who are within Medicaid and work within the Medicaid scope. That's for those who have commercial insurance or private insurance. People are really starting to understand and recognize the work of doulas and as well as midwives, but doulas specifically in far as like assisting them with their birth, whether they choose to have it at home, at a birth center, or in a hospital. In a hospital, they can seek people who are having I'm assuming because we're talking about women's health, I can definitely say the word vaginal health.
Yes, we say vagina on this show.
Fabulous. I just want to make sure nothing gets bleeped.
I don't even giggle or nothing.
Yeah, Jeremy's totally fine with it now.
I was
Love
before. That's why I got here to begin with, I think.
it. I love it. Perfect. I just wanted to make sure. But yes, so whether that's someone who's having a vaginal surgery or sorry, a vaginal experience in birth, or even, cesarean, like, so I see a lot of, doula requests. It's like I said, my number one request as far as does my plan cover this? And if not, is there a nonprofit who can help me cover it? So that would be my answer as far as like what is a common trend that I see. And then as far as, oh my goodness, I didn't know I needed this, but I'm glad I now have, found MINE Maternity, would be actually the care coordination piece of things. And so when we think of being pregnant, I think most people say, okay, I'm going to go see my doctor. I'm going to go see an OBGYN. Fantastic, fabulous, continue to do so. However, I think people, until they're actually in the motion of things, that they don't realize that an OBGYN really is within just one area of the larger tree. And so they're not lactation consultants most times. They're definitely not pelvic floor therapists most times. And so that would help with the not only postpartum care, but you're also your prenatal care as far as your pelvic health. There's so many things that an OBGYN is not that people assume that they are. And while they are fantastic in their field, you need the other tree. And so that's where care coordination comes in that says, okay, well, based off of your insurance plan or based off, your financial goals of being in network or out of network, here are the other components that we can pull together so that you're really prepared for either the postpartum period or that you have the best pregnancy experience that you can have.
Hmm. By the way, and I don't know if Jeremy, you've been thinking about this. I love that the rise of doulas is a thing because we've done what
We got on
three?
that early.
We've done three shows on um
Yeah.
doula, or and it comes up a lot, right? Because it came up in the Delphina episode.
Episodes, let's see, 10 and 11
Yeah, he always remembers the
with
episode.
Latham
I love it.
Thomas.
Yeah, Latham Thomas with Mama Glow. We did a
And
two-part with her.
then Anya was 18, I believe.
Yeah, she's a
So we've
doula.
we've we've had a few doula episodes. Those Latham Thomas ones were awesome. That's
Yeah.
I didn't even know what a doula was before those.
Yeah. Yeah. It used
Yes.
to be such a kind of hippy dippy thing, right? Like only us tree huggers up here in Flagstaff, our crunchy granola moms were doing it, and we're like, that's totally normal. And like everyone else was like, what? That's weird. Only hippies do that. It's like, no,
And now
Yeah,
everybody
that's
wants it.
outdated for sure.
right?
And that's
So
why I
I love
mentioned
that.
all those other birthing experiences because, I've talked to so many folks where I mentioned, they would tell me the care that they want to receive. And I said, that sounds a whole lot like you want a doula. So I'd
Hmm.
mention a doula and they say, oh no, but I want a medicated birth. And I'm so excited to be able to explain to them that that is not a component as far as whether or not you can see, seek doula
Hmm.
care. Any type of birth experience that you have, even adoptive, which is not, I guess, technically a birth experience, but they can even help with the transition of adopting a baby. Or if you choose to have a cesarean, like they can actually support with it, especially postpartum wise, not a birth doula, but a postpartum doula can help with that transition of newborn care. And so I would love for more people to know the options that are available to them, and you don't have to have it just one way.
I didn't know there were adoption doulas. That's interesting too, yeah. But that
Yes.
makes a lot of sense. Like you just adopted a baby and you've never taken care of a baby.
Yeah, you're going
Someone
through.
who can come in and show you how that works. That's great.
Absolutely. It's the same experience of newness. Whether
Yeah.
you
Sure.
adopt your baby or you just birth your baby, sometimes the only difference really that I see is maybe you don't need the lactation support or you don't need like the physical support providers that they can connect you with or guide you in assistance with. But as far as the doula care of helping just balance it out, cleaning the bottles, helping you with night shifts, making sure you have water and you have nutrition, mamas need that and papas need that, but families need that, just to be
Hmm.
general and inclusive, but families need that.
Yeah, that's really cool. You need and the care coordination part. Um, we often say here you need a doula for everything in our lives, right? So it's like a doula for your doula.
Yeah, exactly. Very much so.
But you're I feel like mine is, mine maternity with the care coordination piece, which, and thinking back, by the way, as you were describing that as being one of the things that people don't realize they actually need when they, until they need it, right? Until you're explaining to them, oh yeah, we take care of all these things because it's not just showing up to have your checkups, right?
Yeah,
Throughout the pregnancy. And thinking back to both of my kids, right? Through both of my pregnancies with both my boys. Um, it made me think of like planning a wedding, right? Like you have an event planner or a coordinator, or you do it yourself and it's totally stressful and you're, losing your marbles.
absolutely.
But same thing, right? Like it's a big deal. It's not a one and done. There's so many things that are going on. I'm like, wow, I could have really used help with that.
Definitely. And I love the term that we're saying a lot of like is accessing your village or being part of
Mhm.
a village. That village word is, I love that it's really coming back into play just because as much as it takes a village to raise a child, it definitely like it takes one to welcome a new mom or a new parent into the space because there's just so much that's unknown and there's so much that goes on. And it's like not only just the hormonal physical component, but the even the social aspect of things. It's like you have new responsibilities that you didn't ever have before, and depending on what your culture is, that can be even a more dynamic shift than you might be experiencing because of, again, the subcultural expectations that are now placed on you as a mom and as a wife or a partner, parent in general. So definitely it helps to have somebody who's familiar with not only just with the care that you might need, but be able to provide the educational component of it. So, what's the difference between a chiropractor and a pelvic floor therapist, and when can you access them, and at what point would it make sense to access them for what certain symptoms? That's where MINE Maternity and working with a care coordinator in just general can help as far as like the medical component, and then also the emotional part, which is the doula part, and all the other mental health and therapists and support groups and whatever else you seek.
Yeah, there's a lot out there.
It's a lot.
Yeah, there's
It
a
can be
lot to know.
overwhelming.
And probably most people going through a pregnancy don't know what's available to them. So
Testing, right? You've
that's where
never,
you show up.
yeah. I know if I went through, another medical event that I haven't been through, I wouldn't know where to start. Like,
Hmm.
and so it's exactly the same thing. Like as
Yeah.
far as it takes a lot of different components, because even like I was mentioning with the OBs, even they might not be a nutritionist or have dietitian background. So even that component of, okay, my baby is having XYZ symptoms. What can I change in my diet if it is diet related to help ease that? They might not be the one to answer that question. That's where seeing a nutritionist or a dietitian can come in play. So it's just understanding who to call on your village and when and for what really helps. And then let's talk about the financial piece, making sure that it's within the financial scopes that you're comfortable with. So you can absolutely go out of network. Just know what it means to go out of network if you choose to go that route.
Hmm.
So I'm curious to your specific structure. Do you have your own existing network of practitioners and providers and stuff as far as all of these different services? Or do you just okay take it case by case where okay, this person's in this area, we have to find them these services and then kind of find them as you need them, or do you already have like are you building an existing network across the country of people that okay, we send this person to this person, we send this person to this person? You know what I mean?
I would say it's a combo of both. So because we provide nationwide support, it very much helps to already know which specialists are in which areas. So as we help one family, we build out their network, and then we save those providers and make sure those providers are part of our provider village, so we can refer to them in the future. But it's always going to be about the patient or the client at the end of the day, the individual. So if they're looking for someone with a specific language or background or certification, we're going to find them what they need versus, well, I have, this person already ready available. I'm just going to throw them to you because I have them available. And we also factor in personality types. I would like a doula or a midwife or lactation consultant that has this type of personality. And it helps if we already, worked within the area and met with a number of providers to be like, okay, this person probably would be a better suit based off of, maybe if you want a more laid back individual versus hands on.
But then
So
you
I hope
do
that
keep
answers
them
your
on.
question.
Oh no, that was perfect. So you do
Okay.
find them as needed, but then once you find someone that can be in your network, you actually are still building that consistent network as well.
Definitely. And then we build a partnership with the provider and let them know what we offer and the services, and that we're referring a client or that we have referred a client to them. We always keep client information private. So whether or not they know who the client individual is, unless the client states it, that's, not for me to share. But I'll let them know I did refer, someone to them, and that I'd love to kind of either have a one-on-one with them to get to know them more. Because again, I'm a people person, or I'd love to just keep them, for future reference. And so I always do a personal kind of heads up as well. But again, more
Mhm.
important, keeping the client information private.
I'm curious, have you through this work and working with all these different people, different states, regions, etc., um, have you found that there's like a certain type of person who has like particular needs that is like very well served by your services?
Hmm.
Like having like certain conditions or I don't know, like maybe I keep going to like somebody who's on Medicaid,
Yeah.
right? Um, because there's always so many programs, particularly from the financial perspective.
Yep.
So many programs that you will qualify for because if you're already qualifying for Medicaid, you're it's the whole federal poverty level thing. What are the requirements? Do you get WIC? Is there a local, nonprofit in your town that, oh, also will give you baby formula for an entire year or diapers, things like of that nature?
I would definitely agree with you. So I'd
Hmm.
say someone who's on Medicaid tends to have a lot of resources available to them, but may not know about it. And that's
Right.
everything that you listed, including, diapers available to them, because that's its own, shortage that we're experiencing and that leads to health consequences. So making sure that diapers are readily available, and that's not a financial piece that's straining families. Believe it or not, I will also say that single parents are the one that I've had the most unique cases with as far as care coordination and helping them understand their benefits, so benefit navigation. And I'll specifically talk about single mamas because I haven't worked with yet with single papas or fathers or non-identifying parents. I try to be inclusive. I'm based in California, so apologies. But
Oh no, we're with you.
I'm trying to
We
stay.
love it.
I love it. Great. I'm doing my best to be inclusive, but because I recognize people,
All
but
the parents.
all the parents, but I will specify single mamas in this case,
Hmm.
that they have such unique needs that I had never actually thought about until I started servicing them. And I'm so thankful that they came to me and trusted me with their journey. But, things like child support, I had to read up on child support laws and become familiar with
Mm.
that and the child support case of what that looks like. Also starting to recognize, including the partner on the birth certificate or not. What are the consequences to both positive and potentially long-term consequences of including your partner on the birth certificate. So I would say, and then of course the financial aspect of like I'm trying to work. I see career options a lot for them as a selected service that I need help with. So I need to change my career because I need a remote job now, so I can be with my baby. Because either I one can't afford childcare, or two, that's not the type of parenting style that I signed up for. Even if I am a single mama, I didn't want someone else raising my baby. I wanted to raise my baby. So I would say single parents have been the most enlightening and challenging as far as like really stretching the scope of the services that we provide outside of the typical.
Yeah.
So you help with career stuff as well?
Yes, as far as not ourselves, but connecting them with a career coach, 1000%. And that's
Oh,
something we
wow.
do across the board. So I added that service, believe it or not, after I kept getting a request from the other section of, I
Ah.
would like a life coach or I'd like a career coach because I want to shift my career that once was super heavily, long hours and very stressful, to now something where it's enough for me to pay for what I need to pay for, but it allows me more flexibility in what I'm looking for as far as being with my baby or being with, the parent that I want to be. So yeah,
Well,
career coaching has been huge.
yeah, that definitely goes beyond our standard healthcare model on that one. That's pretty cool.
Financial health.
Yeah, like it becomes a whole like a whole lifestyle coach almost in the end. You can help them because we've only been talking about the healthcare aspect, but yeah, that's cool. Let people know that you do those other things as well. Like full on life coaching. That's pretty cool.
Absolutely. And so the formal, slogan or per se of MINE Maternity is unlocking the financial resources to access pregnancy and post comprehensive pregnancy and postpartum care. And I put that comprehensive word in there just for what you talked about, Jeremy.
Yeah, smart. It,
Recognize.
it it sets you apart from everyone else at just doing, most people, I mean, we have really cool stuff on this podcast all the time, but most of it really is just, it's very healthcare centric. And once in a while, we have someone who does kind of break out of the box and starts, letting it move into other things like that. That's pretty cool. Yeah. Like that, getting single moms new jobs to help them raise their kids the way they want. That's a good step beyond the norm right there. I like that.
Thank you. I appreciate that. And that's our goal with.
And it keeps you open. Like it almost forces you to come up with new ideas of other things you can do now that you open. Like
Yeah.
now that you open that door, you can't close it. You know.
Oh yeah, definitely. It's like, oh, sorry, I helped them with it, but not you. No, no, no. Once it's
Yeah.
open and it's
Yeah.
added on to our list, it's there. Like I said, here we get enough others, we're going to see that there's a need and we'll address it how we can. So
Yeah, I was going to say too, like to add on to that, the career piece too, you've got daycare. I mean, it's all over the news, and people just know it. But the cost of daycare is insane, and many people can't afford it.
yeah,
So I can't even imagine what it must be like to be a single mom, right? And then having to figure all of that out. And it's not, healthcare isn't black and white, right? Like there's a lot of gray area where like that financial or professional, you know, health, right? Like that part of your life will infiltrate your actual health if you don't have that in a good
yes,
place. So,
it all works together.
yeah.
It's all encompassing. And I think maybe Jeremy wants to say something, but
I that made me want to ask if you guys deal with the mental health aspect at all. Like, do you uh, help them find their mental health coverages and get them, talking to therapists and things like that as well, postpartum depression, things like that?
1,000%. And in fact, it's such a stronghold that I have partnered with a couple maternal mental health therapists and companies specifically, letting them know that if they can't service their individuals because of in-network and out-of-network reasons, send them our way and we will help them for free. It's not
Wow.
something to play with. And so if we can guide them over to this is how to access it within your insurance plan, or this is how to access it from a free standpoint. So PSI is a great resource, Postpartum Support International. I hope I got you right. But yeah, absolutely. So postpartum, we do not play with mental health. We take it very serious, and it's not a financial component at all of whether or not somebody can pay for the services. You're gonna get it for sure.
Awesome.
Yeah.
I want to ask this is kind of a a heavier question, because I think it's important to talk about.
Okay.
I may have prepped you a little bit for this. With recent or forthcoming or anticipated policy changes from the current presidential administration, are you concerned with cuts to Medicaid? I feel like we've been really touching on moms on Medicaid. But I mean, if you look at any of the stats, like state
Yeah.
by state, it's like 50% of births on average in every single state
Yes.
are covered through Medicaid.
Yes, it is.
And so we've got impending cuts to Medicaid. I'm extremely concerned. I
Some
think,
places it's 80%.
yeah, depending, and you go even like county by county, you can see really high, particularly in rural areas. From your perspective, is there anything that you're particularly worried about? Something that you're kind of prepping yourself for to be ready for, should any of this actually come to fruition and really have impact?
Yes. Simple answer, yes. We are,
Hmm.
and I've been preparing for this ever since the first Medicaid cut proposals were in place or even talks of it. And so I recognize that within our country, healthcare and politics go hand in hand. And so I actually have a political strategist and I have a chief political advisor on my team, because of how important it is to stay up to date on the policies of healthcare. With that said, we have already been seeing immediate cuts to people being released from their health care. And so I'm taking screenshots now on a daily of states who have been cutting individuals from their plan, because they no longer qualify. And I think I guess I can't say don't quote me because this is being recorded, but from my last post that I saw, I believe it was California had 900,000 individuals lose their coverage. And so we're seeing the effects immediately. And this is going to be something we see over a time period as well, because it's not something that's just going to be, okay, these cuts and now it's over with. It's actually a long-term game if you read the policies. And again, myself and my team, we do, but it's going to be a long-term change. So we're going to see continuous of this. Solutions, though. It's a core value of ours to be solution oriented. You can read on our website, it actually is even stated there. And so one of the things that we're trying to do is, one, and how we can enhance that community-based care that we were talking about.
Yeah.
So individuals can still access the care that they seek, but maybe have it financially at a lesser amount than what it previously was. And then two, how can we hold the representatives who are supposed to be protecting us accountable? So how can we form partnerships, whether it's through MINE Maternity or through other entities, to make sure that people have coverage despite that gap? Or how can we help transition those individuals? So if you are going from Medicaid to a commercial plan, there's a lot of changes that happen from that as far as coverage goes, but as also far as flexibility goes. And because Medicaid comes with a lot of red tape, while commercial plans doesn't come with all those stipulations that you might have had before. So how can you maximize the experience that you are going through, but more importantly, how can you make sure you afford it? So we are, long story to that quick answer that I said of yes, but yeah, we do recognize that there's a shift happening and people are going to be hurting if we're not focused on the solution.
Yeah, I'm particularly worried about, I'm worried about anyone who's going to lose healthcare because we've already got so many people that can't afford it, right?
Okay.
That, there, I feel like there's a lot more people that we don't talk about that are in this like in between space of, well, I don't qualify for Medicaid,
Yep.
right? But I also can't afford to pay for insurance if I don't get it through my employer, right? Or if they don't offer me coverage.
Mm-hmm.
And so, or they're independently employed, right? They're a gig worker, whatever it is, which
Small business.
yeah, like Jeremy, and that's kind of on that kind of work is on the rise more and more. So I think we're going to see a big influence or in influx of independent contractors, gig workers, what have you, that so they don't get insurance through their employer, right? So no private. So
Mm-hmm.
either you go through ACA, the marketplace,
Yep.
or you qualify for Medicaid, right? But
Yep.
then I think where you end up, right, Jeremy, I feel like you're probably
I do not have a job that gets me insurance.
right.
I supposedly make too much money to get any of the state or federal stuff like Medicaid or Access. Access is the Arizona one. And when I go to get myself health insurance, they want to charge me like twice as much per month as my rent for
Yeah.
health insurance.
Yeah. What
And
happens?
and, and I will still have like a $10,000 a year deductible.
Right.
So it's only going to cover me beyond, like, I'm still going to have to pay for the first $10,000. I
Yes.
don't have $10,000.
Yeah.
Like, I don't, and
Well,
people are like, so I don't have insurance.
mm-hmm.
I have a healthcare podcast and I don't have health insurance. Welcome to modern America.
Yeah, no kidding.
Uh,
Yep.
and people are like, well, what are you going to do if something happens? I'm like, well, I don't have $1,000,000 the same as I don't have $10,000. What difference does it make?
Hmm.
If you can't afford it, you can't afford it.
Right.
And
Like,
so
I can't afford to pay twice my rent every month for insurance just in case something bad happens.
Hmm.
Because I won't survive for something bad to happen
Right.
if I have to pay that bill.
Yep.
I'll be homeless and have no food.
Yeah. So
Like, what do you do?
yeah.
What's the solution there? Like, I have no recourse.
Are pregnant
I,
moms
I,
being cut from
I
Medicaid?
live across the street from a hospital
That's
that's a nonprofit. I literally, if anything happens, I have to throw myself on the mercy of that place
hmm
and hope that they'll help me, and then find a way to, just, I don't know what happens when you can't pay the bill, but hopefully I'll still be alive.
Or
absolutely
goes away. Yeah.
that
That's American living right there.
Yeah.
That's 21st century America right there.
Yeah.
it very much is. Your experience and your story, first, thank you for sharing that. For us, I think that's the thing I love about podcasts is this level of vulnerability that comes with it, and truthfulness and honesty and just rawness. So thank you for sharing that with us. And I would say that that experience is what so many individuals are now going through, of what do we do within the gap period. And I will answer as far as like, well, what do you do? It's now time to innovate. As far as insurance companies need to innovate, new, I would like to even beyond insurance companies, but for new startups or new companies to innovate. This is a time of innovation to fill in these gaps. MINE Maternity is doing all that we can, but it needs way more innovators filling in these gaps, because right now there isn't a clean cut solution. Right now, the solution is that you, like your experience, you go without. You go without. You are at the mercy at the hospital that you see, the emergency room that you go to now, because federal law has not changed. They are required to accept you and take care of you. So if you ever do need care, go to an emergency room. They cannot force you away. And then thankfully there are nonprofits out there that help with paying off hospital bills. So if you ever, and anyone in this listening right now, if you're in that experience right now where you had to seek medical care and you don't have enough coverage, or the coverage at all, there are nonprofits out there that can help. And I believe dollar free dollar, there's, I'll have to get you the name of that. Maybe you can link it somewhere. Apologize for not having it for the podcast, but there are nonprofits who can help with the payment of that. And I know because I connected someone who had an unexpected cesarean, had an $8,000 bill that she was not prepared for, nor could she cover, and her insurance cut didn't cover it. Connected her to that nonprofit, and now she's $8,000 debt free. Because
That's amazing.
Yeah, it's very real.
So. Then there's, can I do a little tangent actually?
Oh, Harvey's got a tangent. Here we go.
A friend of mine who has a real job, a really good job, a high level corporate job.
You're not talking about me.
No, this is, they'll go nameless, but a very good friend of mine for a long time. He's successful in the business world. He has a high level job with corporate health insurance that he pays for every month. He was out hiking one weekend and he took a nasty fall, and he like tore his rotator cuff or something. He had some major shoulder thing that ran up some medical bills on him. His health insurance wouldn't cover it because they said it wasn't work related. This guy sits at a desk for a living.
Why does it have to be work related?
Yeah, that's what he had to get, the backup insurance, the Cobra or whatever it's called, to supplement his work insurance to actually get those bills paid. He's been paying that insurance for a decade.
Oh my gosh.
At this company, every month paying for health insurance. Something finally happens where he needs his health insurance, and they're like, oh, well, it didn't happen at work, so we're not going to cover it.
That is some kind of restricted policy.
Even when you have insurance, they might not be covering you. Like that. Yeah. That's the worst part. Honestly, for me, I don't have insurance, so I don't expect anything. He went to the hospital thinking, oh, I have good insurance. I'll be fine.
I have never heard that before.
And they wouldn't cover a dime of it.
I've never heard of it, like getting insurance through your employer that doesn't cover anything that happens not at work.
Yeah.
I don't know what kind of policy that is.
Yeah. It's a bad one. It's one that shouldn't exist.
I guess.
Because he didn't know that. Well, he didn't know that it was set up like that.
Yeah, there's workman's comp policies, which does, that's on job sites. Like we provide workman's comp for my husband's painting company. But that's different. I need to talk to your friend, Jeremy.
Get my blood up a little bit.
I agree with her. I think you need to send her to both of us, because
we need to talk and see what's going on with this policy that he's got here.
Yeah, I'll see if I'll get you his email after.
Yeah, that's really funky.
I don't name anyone until they say it's okay to do.
Yeah, I've never heard that. But to kind of bring it back around here, and I'm looking at the time too, so we got to start wrapping up here. But so obviously Medicaid cuts, policy changes within the current administration, definitely anticipating some stuff coming down.
Yes.
To your point, MINE Maternity, other companies, we need to innovate. Like, now's the time, because sorry, but the government, the insurance companies are not going to save us. So we need like the smartest minds in America and beyond, right? Quite honestly, I think a lot of our startup founders, they come through a lot of these great international programs.
I'm part of several international femtech and development.
I bet you are.
yeah, community. So I listen to those in India and then those who
Yeah.
learning from England. Absolutely,
Yeah.
they're doing things differently than us. And I think
Yeah.
we
Healthcare is global. It doesn't
Oh yeah.
doesn't know state boundaries and the when you go into the next city or county. Um,
need it.
yeah, so I'm all here. That's why we're here. I mean, literally, that's why the uprising even exists, is so that we can we can give companies like yours a platform to talk about the innovative work that you're doing to make things different. I mean, I think about even like going back 20 years ago, like it was you're SOL, like sorry, there's nobody here to help you. Like, here's your insurance plan. Good luck and Godspeed. Like, and
Especially
now,
for those who are on Medicaid, they'd
yeah.
actually oftentimes, and I haven't seen a state that changes this, but you're assigned an insurer first.
Hmm.
So you might not even know what actually your benefits are because they get you one, and then those individuals are responsible for connecting with you and
Right.
giving you that information. But maybe you get it, maybe you understand it, maybe you don't. So far, my number, for increasing number of individuals would definitely be those on Medicaid because they just are like, is birth even covered? And I'm like, wow, that's a really big question for someone who's about to give
Yeah.
birth. And I'm glad they come to me. Please do. But that's the extent of not knowing what your plan covers. And again, it's not your fault. So
Yeah. So, MINE Maternity, to put a bow on this, is really it's an invaluable partner to somebody who is pregnant and postnatal through the process of all of that to help you navigate all of the benefits, all the resources, all of the things that you might need that you don't even know. I mean, you're like a great you're a partner, somebody going through all that. It's like your own personal, I say like an event coordinator, except
yeah, like a
the
concierge.
event is having a baby.
Yeah. Well, baby concierge, but yeah.
Baby, there you go. Yeah,
Maternity concierge.
Even
But
roll out a little red carpet.
yeah,
yeah,
and
exactly. Yeah.
yeah, and or a pink or a blue carpet,
Oh, there you go.
maybe both. I love it. Well, this has been really interesting. I've never heard of a company like yours before. Um, so
A lot for
really,
somebody who's
yeah,
in this deep within this space. So thank you.
yeah. So you're definitely, I think you're serving a need that um there's a there's a lot of need, you know, whether you realize it or not. I think we can all use help navigating healthcare. So
Navigating life in general, actually,
yeah,
with all the new stuff you're adding on to your network there.
yeah, exactly. So
I love
let's
it.
end on a happy note instead of us
Yeah.
complaining about how
I
insurance
I can
sucks.
complain about insurance for another hour if you want.
Oh, part
I got
two.
plenty
Love it.
left in me.
How we need to do better. Okay, that's like a whole nother show, Jeremy.
And
Absolutely.
I almost need my
I will
own
be present.
separate podcast for that.
Right.
We'll do
What's
that.
next for MINE Maternity? What's coming down the pipeline? Do you have any like big changes coming? Is it just focusing on that growth, building that provider village?
Yes, absolutely. So I'm very excited. I have nothing to formally announce yet, but as far as sneak peeks into the pipeline, we are focusing on finding ways to digitize and automate the process of being able to look into your insurance and get an aspect of a benefit navigator right away. And so that's a system that we're in a software that we're in the process of creating. And then, of course, we're trying to branch out as much as possible and get a network with insurance companies as well as hospital systems. And so we are available on Find Help through UCI Health System.
Oh, I know that. I know that organization. Yeah.
Absolutely. So we just launched our program onto there, and so anyone who's with the
Awesome.
UCI Health System and familiar with Find Help, they can find us and connect with us there. So
Yeah,
we're
that's a great, great, great resource. Find help. We'll have to put that one in the show notes, Jeremy, because I've known about them for a while. Wonderful. Well,
And what's your actual website?
yeah, I was just going to ask that. Share with us your website, where we can find you on social, how someone can get started with you.
Absolutely. So website is www.minematernity. That's MINE. So minematernity.com. And then as far as Instagram and YouTube and all of the other social medias, it's MINE Maternity. So MINE Maternity.
Awesome. And then we know you can go to the website to find you to get started, or
Oh, yes.
potentially through a clinic, right? A provider maybe already working with you. So
It's
I imagine they have some kind of, they'll share that if you come in and say, "Hey, I'm pregnant," right?
Yeah, definitely. So you can, connect with your provider and ask if they're familiar with MINE Maternity. You can also reach out to us on our website. We have under services, we have two different types. So if you're an individual looking for, specific services for your own journey and experience, connect there and you can get started with our process and getting connected with a benefits navigator and a care coordinator. If you're a business, so that's any type of maternity related business, and you want to either grow your business or even establish your business, we have services for businesses. So, again, that's the add on care coordination, that is billing support, benefit navigation, and then any consultations that you seek.
Excellent. Well, Pasha, thank you so much for coming on the show. I've appreciated hearing about all the work that you're doing and being a part of the kind of the evolution of healthcare, and particularly in women's health and maternal health. So
Definitely. I'm just
we're
doing my.
glad you exist.
Oh, thank you. I love what I do. So I appreciate
Good.
it. Cool.
Awesome.
All right, there you go. Our conversation with Pachet Bryant. Uh, cool stuff. Wide spectrum of things they're doing for the women out there. But what's our main takeaways here, Heather?
This is just like a normal thing I think we need to say now, is that there's a lot of things that we need to help people with in healthcare,
It's those crises we were talking about in the opener again.
all those crises. Yeah, maternal health, being pregnant, trying to get pregnant, after being pregnant. I mean, there's a
Yeah.
lot of, women make up 50% of the population here in the United States.
And that's a point you just hit actually is a lot of people like the pregnancy coverages. It's like once you have the baby, it's just like, okay,
Like,
you're done.
peace out, bye, good luck,
It's nice to see
Godspeed.
people having the follow through to be like new moms need help too, not just the pregnant ones.
Yeah. So, we're meeting, I think, we meet with a lot of people who are addressing various aspects of women's health, and specifically around pregnancy, both, during, after, beforehand, kind of all of the stages,
Yeah,
it,
from fertility to pregnancy to birthing.
which can be a really long period of time, for a woman,
Yeah.
especially if you have multiple children. It can be decades of your life, and lots of things can change. And so I love seeing how Pache has created this company, MINE Maternity, to help with the financial, particularly the financial parts of it. She talked about how many of the people that she does help from this kind of care coordination, benefits navigation perspective are Medicaid members. Medicaid members, high need. I mean, nearly, if you look at like state statistics, it's like almost like half of pregnancies are covered by, and babies are birthed under Medicaid plans. Plays a very, very big role in our country. So alarming that we're going to be seeing some cuts here, which
Yeah.
we touched on that a little bit. But there's a lot of resources out there that aren't even necessarily promoted to these plan members. So you know, she's doing it. She's showing up for these people, and kind of showing them the way and holding their hand through it and getting them connected with the things that they need. So,
And allowing them to take advantage of the things that are totally readily available to them, just nobody's telling them about it.
yeah,
So yeah,
exactly.
that's a very helpful thing. Yeah.
Yeah. So, and I think sometimes too is that, the health plans, particularly like Medicaid plans and stuff like that, they've got a lot of different benefits and resources, and it can vary based on who you are, right? Because Medicaid plans kind of have, I don't want to call it sliding scale, but there's a lot of variability in who's covered. And so I think sometimes they just don't do a very good job. Government in general doesn't do a very good job at communicating things
Yeah.
accurately. So, Pache is showing up in this kind of care coordination role to really connect people. We talked about doulas again,
Yeah.
so doulas keep coming up. So
Gotta love the doulas, man.
yeah, I
Have
think
you hugged your doula today?
seriously, we should make a T-shirt.
That would make a great t-shirt.
Yeah, I mean, another place for doulas to show up again, and I love that it's becoming this very common thing. So,
Yeah,
cool
and
stuff.
I had never heard of them before episode 10 with Latham Thomas.
Now you know all
Now
about
it's
it.
like they're everywhere. Like everyone's starting to talk about them
Yeah.
through the whole industry. It seems like anyone who's involved with the pregnancy side of things. So which is really cool because honestly, it's they're covered by the benefits, and they fill in this gap that is, so needed to be filled. And you just got to let people know that it's there, and then everybody's going to want it.
Yeah.
For good reason.
Yeah. Yeah, so she's building, I want to mention too, the provider village that she's building out, because, we talked about this too, is that, and this has come up in a couple of episodes. People don't create relationships with their health plans or their insurers. They create relationships with their providers, and those are relationships that they will carry for, potentially decades, depending. And so I think it's really smart that she's going through provider groups like OBGYNs, other nonprofits, doula organizations, things of that nature. March of Dimes actually is one of them as well. So I think it's really cool that that she's showing up that way. So, ask.
Yeah.
If you're working with an OBGYN already, or a local doula, ask them if they know who MINE Maternity is.
Yeah.
And if they don't, send them to MINE Maternity.
And we talked about that whole, the relationship not being between the insurer and the patient. It's between the insurer and the company that the patient works for.
Mm-hmm. Also that. Yep.
Who are we talking to? The guy you used to work with. I'm dropping.
Wellbe Health.
Wellbe
Seth,
Health.
yeah.
Seth from Wellbe Health. It's that's really the whole thing is you change jobs and you change insurers. They don't have
Right.
a reason to have a real relationship with you, because you could come and go anytime.
Right.
Which to me is just another reason why we need to socialize medicine, because then everybody would be on it all the time, and they could develop a relationship. You know what I mean?
Yeah.
Like there could be those proper relationships between the insurer and the patient.
Yeah.
Because you're always going to be on that same plan. You're not going to change.
Yeah.
They know that, so they can take care of you.
It only reinforces that patient-provider relationship is critical.
And we spend 5 times more per person in this country out of the tax fund than places that have socialized medicine. It costs us 4 times more to not socialize medicine than to socialize it.
Yep. But
I could go on all day.
You could.
This is the one part of healthcare I actually know about.
And so we have, but then it creates places for Pachet Bryant and MINE Maternity to show up.
Well, right. And
sometimes you wish they didn't have to.
But the fact that there are people out there trying to solve for this problem is a wonderful thing.
It is.
It's unfortunate.
And that's why we're here.
It's unfortunate that they have to. It's wonderful that they are.
Yep.
I guess is my point.
Exactly. So with that,
I don't know what kind of message I'm putting out there.
Let's just roll with it.
Anywho.
I like it, Jeremy.
Yeah. So before I get any farther down the wormhole, let's start wrapping this up, I guess.
Yep.
So if you like what you hear, make sure you hit that like and auto download and ring the bell, make sure you follow along on whatever platform you're on, so you keep up with the uprising here. We are on all the major audio platforms. We're on YouTube. We have a Patreon if you want to throw us a little money. The YouTube and Patreon are video based, so you can see what we look like over there if you like. We haven't done this in a while. I forget what else I'm supposed to say, so I'm just going to let you take over yours.
You can find us online at healthcareuprising.com as well, which basically points you to our Patreon page at this page, or our Podbean page at this point. So working on that. Otherwise, follow us on the social media channels. We're on Instagram, we're on Facebook, and very active on LinkedIn and also on Blue Sky. And we post up whenever our episodes drop. We like to share stories from people who have come on the show. So it's a great place to kind of keep in tune with what's happening in the healthcare universe. I think that's it. I'm also a little rusty here. So with that, keep looking for the good in the world, because sometimes it's where you least expect it.
This has been a Shut Up production.